Hello. This is Jessie. Jessie came to supportive care and actually graduated from supportive care. She was a whole 3 months here on supportive care. And I'd love to know from Jessie, what did you think about it? I mean, you got some education on what supportive care is all about, but did you really expect what was going to happen?
No, I did not. At first, I didn't want to get involved in the program because I was unaware of what the program was all about. After speaking with Juliana and visiting with her, or she visiting with me, and she explained the whole program and what it's all about. And I thought, I'm being selfish by not wanting the help and the care. So I called and said that I was interested. And I had 3 months of the palliative care. Was very positive, very positive. They helped to keep me positive, get rid of anxiety. Overall, they did a great job to get me to where I am today. I enjoyed the yoga. I enjoyed everything that they had to offer. I look forward to their visits. Juliana is very, very well versed, informed, and compassionate, and I just love her because she would come here and we'd talk story, and I'd feel so much better just being able to talk, and by that I got rid of the anxiety. Other things, I did have one emergency, or two emergencies, I should say, and she was there. She was here. She came to see me, and decisions were made and worked out fine. Except for one time, but that had nothing to do with the palliative care. My blood pressure dropped, and I was taken to the hospital by ambulance. But Juliana kept in touch with me. Dr. Weiner kept in touch with me, and as a result of the palliative care, I only wish it could continue. As a result of it, I am a lot better, stronger. I am on chemo. Thank God I don't have any of the major side effects of the chemo. And at the last check, the tumors are stable. However, I still am monitored every other month. But I just want everybody to know that palliative care is not the end of the world. It's not the end of your life. It's the beginning of accepting life, quality life, and making the best of it. I wouldn't go nowhere. I was in such depression because I was in the hospital for so long, and today the only thing I don't do is drive because my judgment might not be the greatest. But I would like everybody to know, if they recommend palliative care or even hospice care, it's not the death sentence. It's to help you to live a quality life. Quantity is one thing. I don't want to be alive and no quality. So again, my message is out to everybody out there. If you get diagnosed with the big C, and they talk about palliative care, and before you make a decision of saying no, find out what the program is all about. And a big mahalo to palliative care.
Oh, thank you so much, Jessie. That's beautiful.
Tripod.
Okay. Hi, Bob. This is a little conversation about your experience in supportive care. you were not the patient, but you were the caregiver of one of our supportive care patients. Do you remember how it came about that you were...
Right after my brother's surgery, his second surgery, pain medication was needed. Dr. Murphy kept changing the prescription for a little bit more, and he was the one that suggested that we come to the palliative care, and Tom received excellent care. Dr. Wiener and Juliana, they were always there for any questions that he had. They were there for the support, and if he needed his prescriptions, his pain medications revised, updated, it's like they already knew what he needed. And care all the way up through the palliative care for, I believe it was almost 3 months. I think it was the 3 months and 90 days before he went into the hospice.
How did this transition work out to you? Was that something that you thought would happen?
It was all, well, we didn't know, I didn't know what really to expect, but it was so smooth and so easy and so stress-free. They just knew what to do.
In the beginning, when Tom was on supportive care, there was really no talk about dying.
No.
Tom was hoping for
Yeah, he was going to be starting into his radiation and chemo. He was all very positive through the whole process, and supported in what he was preparing for, and it's wonderful.
And then what happened when it announced itself that he was actually declining? How did the supportive care team respond?
Oh, I mean, like you said, it was so smooth, and they were caring for both of us. You know, it was a process that we were both going through, and the positive feedback that he was getting, his positive feelings that he had, always for the positive end, and the supportive care, the palliative care, helped in that tremendously.
Did you ever consider hospitalization?
No, that's, I wanted him, and he wanted to be at home. He thought about it at one time because he didn't want to put my wife and I out being in the house, and we told him no, you know, it's fine here, and the palliative care, Juliana was supportive in helping keep him at home and feel comfortable at home, and made us feel comfortable with him being there.
And how did you personally go through the process emotionally? Was it easy for you to accept that he was not going to get better? What happened? Did you get support in that direction?
Oh yeah, I mean, it was, you know, I can't imagine having gone through that and not have had the palliative care before, and the care that hospice gave after that. It was, I mean, I just don't know what we would have done or how we would have felt, but it was a real caring, real supportive, and we felt good. And you know, Tom, he was always had a humor going, so he was, it was great. It was great.
So what was the end then? Tom died at home?
Tom, yeah, died at home. The plaintive care had smoothly transitioned into the hospice care. Juliana was there the whole time. Dr. Weiner, the whole staff was very supportive. Like I say, I don't know what we would have done. I mean, I had no idea. This is the first time that I had gone through being with a loved one and them passing. And yeah, I don't know what I would have done.
Thank you very, very much. So you would recommend supportive care for people?
Boy, yes, yes, more. There's no doubt. I mean, if people are in that position, they really need to come to the plaintive care, and the program is wonderful.
Thank you so much.
Yeah.
Hello, sir.
What are we on candid camera for?
Where are you going?
We are going to yoga.
Tell me about it.
Sneha Han is my instructor.
Ah, and how does
And
it
I'm learning
work?
how to breathe better. And I might live longer. Beyond that, it's day by day.
You get a new toy?
This is my yoga class. Good morning. How you doing?
Hi, come on in.
How are you?
Welcome, my friend.
Thank you.
Outrigger Canoe Club.
Yeah.
Have a seat.
Enjoy.
Thank you. Here's your flower for today. Bye, Juliana. Okay, so we are talking about.
She's not with,
You guys are all separate? Okay.
yeah, I'm the, I would be the provider, so he's probably about to do it, so.
Yeah.